So, advice for new grads is, this was my experience. You go into school, you think you know everything. You get out of school, you learn that you don't know everything, and when you start practicing, you realize you don't know anything at all. It's very difficult to really jump into clinical practice immediately and expect that you're going to have all the great benefits of being able to get people better and make a lot of money. That's not going to happen. What we need to be focused on when we're out of school is continuing to learn. And your first jobs, your first opportunities, those are where you're going to be able to mentor with somebody. Find that great mentor, find that location. You know, for me it was sports medicine. That's what I've always wanted to do, so I immersed myself into that environment. And I did extra hours. I worked Friday football games. I worked Saturday morning injury clinics. It's not 8 to 5 anymore. If you really want to get into something, particularly like sports physical therapy, you really have to go and pay your dues, do the extra work, and really start to meet people. The most important thing in this profession or any profession is really about networking. So taking opportunities for being places like at TCC are great opportunities to go up and just shake hands and introduce yourself to people and just start to develop that network. So networking, staying current with the research, following things on the journals that are out there, going to continuing education, just do a little bit more than you need to starting out.
So if I could give the new grad advice, the first thing I would tell them is to understand that when you're in practice for 1 month, you've only been practicing for 1 month, right? And at the end of a year, you will have 12 times more experience than you did when you first graduated, because now you've been there for 12 months. And at the end of 2 years, you now have 100% more experience than you did at the end of that first year. So don't rush things. Don't think that you have to know everything. Don't think that you are now this God's gift to patients. But the reality is that you are an incredibly bright and probably very caring person to get into this profession. So lean on those around you. Now, the second thing is you're going to be bombarded with continuing education seminars when you first graduate. What I will tell you is first learn how to be better at examining and then immediately helping patients. Don't worry about learning all of these advanced techniques right away. Get better at therapeutic exercise, get better at examination, get better at manual therapy. When you do that, you will find that you will be able to dramatically help your patients and you will feel better and more confident about being a physical therapist.
The biggest issue I have with our new grads is that they're coming out with a predisposed idea of what the world is like, because our DPT programs, which are incredible, are still not showing the reality of what the market bears. We're the only business model that I've ever seen that your worth is actually determined by a third party. I do business with one person, but somebody else pays my bill. And in my whole history of my profession, I've never had an insurance company call me and tell me that I did a better job than the other guy, so I got a raise. Always remember that you come out and you can be a PhD, a DPT, or anything along those lines, but your rate of reimbursement is the same as someone who has a BS. So we have to somehow differentiate ourselves of every other healthcare profession and add worth to what we're doing. We've devalued our profession from the whole medical side of things has been devalued because it became a right to have health care. And it's one of those things that, yes, we need to provide health care for others, but we should also have the same value as the plumber that goes to my house or the guy that repairs my AC unit. He bills what he feels he's worth, and I pay extra if someone gives me better care or better service. So that's kind of I think the eye-opening thing that a new grad needs to understand. This is not a bad thing, it's actually a good thing. There's very few in our profession that are going to take the bull by the horns and try and differentiate themselves, which is fine by me. I mean, I want to be, there's a reason I pay more for an Apple computer than I do for a Dell or an IBM, because I get more for my money. We want to make sure that people want to spend more and get more for their money.